So hi all, in this video we are going to discuss about joints, which is from the unit musculoskeletal system. So joints, which is also known as articulations, are points where bones meet, and it also allows movement and the stability of the human body. Role in musculoskeletal system, the role of joints in musculoskeletal system is it works with bones and muscles to enable locomotion, support and flexibility. So the importance of the joints are it facilitates daily activities such as walking, lifting, sleeping and etc. and protects the skeletal integrity. So joints are classified by structures. So it is classified by three different structures. First thing is fibrous joint. It is connected by dense connective tissue, minimal and it has no movement. For example, sutures in skull. And cartilaginous joint, which is connected by cartilage, only limited movement will be allowed. For example, intervertebral disc. And the third joint is synovial joint, which is full of fluid-filled cavity, freely movable. For example, knee and elbow joint. So, and by their function, the joints are classified by their function. Synarthrosis is nothing but immovable. It cannot move. That is also known as the skull sutures. Sutures will not get moved. And the next thing is amphiarthrosis. Amphiarthrosis it can move slightly, not freely, slightly. For example, pubic symphysis. The third thing is diarthrosis, which is a freely movable joint. For example, hip joint and shoulder joint. And the structure of synovial joint. It is made up of articular cartilage. Articular cartilage is of smooth hyaline cartilage covering bone ends, and it reduces friction. And the next thing is joint capsule, which is made up of fibrous is made up of outer layer and synovial membrane with inner layer. Next thing is synovial cavity. It is a space-filled synovial fluid. Next one, ligaments. Ligaments which reinforce joint stability. And the next thing is menisci and brusae. Menisci is nothing but cushion, and it is used to reduce friction. For example, menisci in knee and brusae around the shoulder. Synovial cavity, the cavity is nothing but a space. So the synovial cavity defines the space between articulating bones, and it enclosed by a joint capsule. Synovial fluid, which is produced by a synovial membrane, it lubricates joints, nourishes cartilage and absorbs shock. So its characteristics is about viscous, clear and contains hyaluronic acid. So there are 6 types of synovial joint. Hinge joint, which is uniaxial in movement. For example, elbow joint and knee joint. Next thing is ball and socket joint. It is multiaxial in movement. For example, hip joint, shoulder joint. And the third joint is pivot joint, which is rotational in movement. For example, atlantoaxial joint in the neck. The fourth joint is condyloid joint, which is biaxial movement. For example, wrist joint. And the fifth joint is saddle joint, which is biaxial and greater range. For example, thumb and carpometacarpal. Sixth joint is the sliding movement joint. Example, carpal bones. So movements of the synovial joints are flexion and extension. Flexion is nothing but bending, and extension is nothing but straightening. For example, elbow, which gets flexed and extended. And abduction and adduction. Abduction is nothing but moving away. Adduction is nothing but toward midline. For example, arm abduction. And the next thing is rotation, turning around the axis. For example, neck rotation. And the fourth one is circumduction, which is of circular motion. For example, shoulder joint. And the fifth one is special movements, pronation, supination, dorsiflexion and plantar flexion. So pronation, supination will be done in the will be done by the hand. And supporting structures and the joint stabilities are the factors which affects the stability of the joints are shape of the articular surfaces. For example, deep hip socket versus shallow shoulder, and the ligament which strengthens an arrangement, muscle tone surrounding joint. Supporting structures are ligaments, tendons, brusae and menisci. So common joint disorders are, the first thing is arthritis. There are two types of arthritis, osteoarthritis and rheumatoid arthritis. Osteoarthritis is nothing but it is an abnormality in where cartilage will get degeneration, which is common in aging. And rheumatoid arthritis, it is mainly because of autoimmune, a person's autoimmune disorder, and a synovial membrane will get inflamed in that abnormality. Next thing is sprain, where ligament tears or due to overstretching. And the third thing is dislocations, where bones get displaced from the joint. And the last thing is bursitis, where inflammations of the brusae will take over. So these are the common joint disorders. So normal anatomy of the shoulder looks like the first image. Anterior dislocation looks like the second image, and the posterior dislocation of the shoulder joint looks like the third image. And the healthy brusae of the knee joint looks looks like the first image of the second picture, and the inflamed brusae looks like the second image of the second picture. Thank you.